this video, I want to talk about why your knees may be hurting when you walk up, or even more when you walk down the stairs. And a reminder, guys, that if you like our content and you enjoy the things that we bring out to help with your health and well-being and achieving some sporting goals, then make sure you subscribe to our channel and hit that bell notification so that we can be updating you on when we bring out new content. So one of the common things that I hear in clinic is walking up the stairs, or even more so down the stairs, is something that is painful for my knees. And people are often quite surprised by, in particular, why going down is a problem. So what I want to do is explain why your knees may be hurting. First of all, what I want to do is explain a little bit about the anatomy of the knee, and what I find tends to be the problematic structure when people are talking about walking up and down the stairs. Most commonly, there's multiple structures around the knee that could be playing a part, but today what I want to talk about in this video is what we call the patellar tendon. This is the tendon that crosses over the front of the knee. Now, this is the tendon. We know that a tendon takes our muscle and it attaches it to a bone to allow it to move that joint. So what happens here with this patellar tendon is this is the tendon of your quad muscles or your thigh muscles. So why is this relevant? Well, if we have some dysfunction of those quad muscles, what they can end up doing is pulling excessively when they're activated. So what happens then is when we look to walk up the stairs, we have to contract our quads, and so they pull on this problematic tendon, and therefore with this tendon crossing over the knee, we then feel that pain around the knee as we walk up the stairs. But I mentioned that people often find going down the stairs to be more problematic. This may be something that you have. Why is this? Well, this is because we are using the quads for a different type of muscle contraction. This is what we term an eccentric muscle contraction. And this is perhaps the most difficult or the most loading of ways for our muscles to be working. It's when they're working as they're lengthening. Now what's happening here is the quadriceps are having to brake you as you go down the stairs, or decelerate you. So obviously what we don't want to do when we're going downhill is topple forwards. So the quadriceps muscles perform this eccentric contraction. I don't want to get too detailed into that, but it makes perfect sense that if you've got this problem in this tendon, that going down would be even more problematic than going up. So we know that, yes, the pain is at this patellar tendon that's crossing over the knee, but the actual cause is coming from these quadriceps. So why might this be happening? Well, there's a few reasons. Firstly, it might be that the quadriceps are too tight and they need to be stretched. It could be that the quadriceps are actually really flexible, but they have an antagonistic pair, or what I like to call a sibling. Certain muscles have another muscle that they need to work with in harmony, and we call this an antagonistic pair. I describe this as a sibling relationship, in that they need to work together in order for things to be working correctly. So for the quadriceps, we have our hamstring muscles. So it might be that the quadriceps are actually super flexible, but because the hamstrings are really tight, the quadriceps are having to overwork and they're causing dysfunction at their tendon. So it's really important that we understand perhaps where the problems are coming from. It could just be that the muscle actually isn't strong enough to be coping with the demands, and therefore any work that you're doing is damaging the muscle tendon. So how can you be working out why your problem might be happening? Well, the first thing I would encourage you to do is to test the flexibility of your quadricep muscles. In order to do this, you lay on your front and you look to pull your foot towards your bottom. Now, for full flexibility, we should be able to catch hold of our ankle there and pull that in towards our bottom so that it touches our bottom. It can be a difficult exercise to do, but this is something that we're aiming for. How do we test the flexibility of our hamstrings? Well, in order to test the flexibility of our hamstrings, we lay flat on our back. And then what we look to do is lift our leg up to straight, importantly keeping our knee nice and straight and locked out, so we have a fully straight leg. Again, to have full flexibility of the hamstrings, we should be able to bring that leg to 90 degrees without the knee having to bend. Have you found that you can't do either of these things? Well, that's an indicator that you have a lack of flexibility in that area, and that will be affecting the knee. So if you're suffering some of these pains, what I will be looking to do is take those tests and do those as a stretch to hold those for 30 seconds. How can we look to be testing our strength? Well, this might be where we're looking to do an exercise such as a squat or a single leg squat. As you drop into this position, can the knees remain nice and still and moving down over in line with the middle toe? If your knees drop in, there's an indicator that perhaps we're not strong enough for this area to cope with those demands. So that's something that you then can be working on to improve. I hope this makes sense. It's a quick video about a topic that can be quite detailed and we can work with. But what I wanted to do is, if you are somebody who's suffering with pain, if they're either walking uphill, walking up the stairs, or even more so going downhill or down the stairs, this might be the reason. You want to be looking around that patellar tendon site, and importantly those major muscles crossing the knee with the quadriceps and the hamstrings, to understand the relationship. I hope this has been helpful. There are many other things that can be a problem, but this is a common thing we see in clinic, and I wanted to give you some tips to be getting going straight away on stopping that pain that you do not have to accept or stand for when you're walking up and down the stairs.